community station. This is Bobo FM. The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
The Health Services Authority has over 120 world-class physicians offering the most comprehensive range of specialist services on island. Our dedicated team of professionals provide the highest quality care in orthopedics, interventional radiology, women's health, geriatrics, and a host of other specialist areas. We are a JCI-accredited organization with a proven record of excellence. At HSA, we are committed to caring for you. For more information, visit hsa.ky.
Do you have a healthcare question but not sure who to ask? Contact HSA's Patient Call Center to speak to one of our experienced clinical team members. We are here to answer your questions and help guide you through your healthcare journey. Need to make an appointment? Our team can help. Contact HSA at 949-8600 or email info@hsa.ky. At HSA, we are committed to caring for you.
And we want to welcome you to the show. Don't forget, if you have any questions at all, please go to our social media. We're happy to answer it. Pass it on, of course, to the sources that are here right now in the studio. And you can find us on social media at Bobo 103.1 FM. Now, I have the pleasure of having some very important members here from HSA. And I always say they're all important, but we just so happen to have the Chief Human Resource Officer, Samantha Bennett, is here. Training and Development Manager, Marsha. How do you say your last name, Marsha?
Marsha Eleweanya.
Not going to attempt it at all, but
Marsha
great
E.
name. Unique and great name. I love it. Human Resource Manager also, Andrea Brown, is here. Ladies, welcome to the studio. The first thing I want to ask is, of course, now that we know your titles, and they're very important titles for HSA, can you guys give us a background on what your day-to-day looks like at HSA?
Well, I would start by saying that no day is ever the same in HR at HSA. How about that?
I figured.
I actually had two persons that started this morning three persons actually in HR this morning, and then that's fresh off what I've just said, and I actually said that to them as well, and I said, you'll enjoy your experience here. We have multiple opportunities here. We have over 1,300 staff.
Is it really that amount?
It's over 1,300 staff. More than 50% are Caymanian, which we're very proud of.
Yeah.
And in actual fact, when you think of the clinical and the healthcare, we talk a lot about the patient experience, but within HR, we talk about the employee experience.
Yeah.
So it's all about internally helping, externally helping, and providing support to our employees and our managers within the HSA.
Yeah, I'm glad that you guys are here in the studios, because every time we have your staff members stop by, I am pretty much shocked and never get over it, the amount of people that have been with HSA past 20 years.
Oh, yes.
A lot of staff members seem to stay with the job, and they have nothing but good things to say. Just how advanced HSA has been over the years and stepping it up, and just different departments, different experiences are now opening up. So I guess what I'm trying to say is I'm happy now that we're interviewing the HR department, because that goes to say that you guys are doing a phenomenal job in order to keep these staff members there for that period of time.
Our retention rate, our turnover is less than 10%, which is particularly good for the healthcare industry. Marsha heads up the orientation, and we do a very in-depth orientation for all staff that come on board. It's a whole week in actual fact. So we really give them the foundation to understand the culture, the policies, and the way we do the HSA thing at the end of the day. And she'll tell you that many people leave us, but they always come back.
Yeah. Grass is not always green on the other side.
Come back. They always want to come back. And then, we're good with them having a little vacation, but they always want to come back.
Yes.
And,
yes.
we're always happy to allow them to come back when the opportunity arises. But again, I would say that to say that people don't also understand that HSA is a big organization, open, 24/7, 365 days of the year. We were just counting the locations. There's probably about 12 to 15 locations overall. And we're covering the healthcare for everybody on this island. We can't turn away anybody at the end of the day. So we're here to provide service and support to the Cayman community. And we have to have the right people in the right place to do that.
It's very important. Very important. And I know you guys are that's a very strict thing that you guys have in making sure you pick the right people for the job and aiming for it to be Caymanians too. We love that. Now, the first question I have for you guys is, how does HSA support career growth and advance for its employees? Advancement.
Andrea, you want to?
Well, the HSA supports our professional development through training programs. And this also varies between our actual mandatory training programs, certifications, mentorship, and internal promotion opportunities. We always encourage staff to pursue continuous learning, and we are very supportive of that as they grow into more specialized or leadership areas.
Yeah.
So can I just say one of the benefits that you do have when you come on board in the HSA is 5 days of education and training leave, which you can, obviously it has to be relevant to your role, but we allow for that. That is special leave that is given to all staff members within the organization, which is 5 days each year.
What if somebody wants to, and I'm just asking for any staff member, future staff members, or anyone that is happening to work with HSA right now currently, and they probably know this information already, but if they want to go overseas and advance their skill set, do you guys offer the...
So we provide, I mean, in most instances, there's some support on that side, whether it's through the scholarship committee. We try to support them with, in some instances, depending on the amount of time they're going off, a stipend. But also, we give them unpaid leave, sabbaticals, so that they can actually take a year or to specialize or to do a master's and stuff like that. So, yeah.
I love that.
Yeah.
I love that. What I do want to ask, and this one is 100% not on our list of questions, but I have to give compliments to this. I realize that there's a lot of students that tend to go overseas and they're studying in the field of medicine. And then when they do come back, they're hopeful, and this is more than just medical students, but corporate fields, lawyers, maybe people that wants to work in a government entity somewhere, and they tend to come back and they struggle to find jobs. We know that story. We've heard that story over and over with a lot of Caymanians. How do you guys manage that? Because I kind of feel like you guys do an excellent job, and if somebody's going away to study anything to do with medicine, then they almost are guaranteed, I want to be careful with that word, but they're almost guaranteed a job at HSA. How do you guys manage that compared to the other corporate companies across the island? Because you're doing a phenomenal job. Maybe somebody can learn from what you guys are doing.
Well, thank you very much. We are very passionate about that. And we start off with our internship program, our summer internship program. That opens actually April 1st and closes April 30 for applications. So students will come back in the internship program. They get the opportunity to work with real life professionals, and so get the exposure they need over the tenure of their training. And after their completion, we usually have internships where they will complete. So for example, the nursing students, they will go through the transition to practice program, and that's a 1-year program under the tutelage of senior professionals. The medical students also have the option to come back and do their internship under the medical directorate as well. So we do have programs for them which are structured, and so they can come in and go into the profession seamlessly.
Essentially, we're forging that relationship with that individual that's in college or university or is studying that particular clinical area or medical field, and so we give preference to those individuals for our internship program.
Love it.
Our internship program on an annual basis, it's been around for a long time. We commit to up to 80 plus positions for 6 to 8 weeks of placement, and those clinical medical persons are prioritized through that. And many come 2 or 3 years, and so we know when they're returning back, so we can plan ahead. And often we're tracking these individuals, so we know when they're coming back, so we can anticipate filling vacancies. What we've introduced most recently is turning posts into a junior post, because even though you may acquire a degree, you don't have the experience, but you have to start somewhere. But we can't put you in the full-time post until you've worked alongside some of the professionals. So as Marsha mentioned, the transition to practice, you get a nursing degree here, but you can't now be in charge of patients or, doing certain things. So you come on the transition to practice program with HSA, and we have about 6 to 8 of them a year. And basically, you are rotated through all the various areas and wards of which touches a nurse, and you are being you have preceptors that are training you or mentoring you, And then after a year, then you move into the actual being an actual nurse. So that is a big program that we introduced, but we've done it now for a couple of other areas. We've done it for occupational therapists. We've done it for physio. We've just hired a junior paramedic, returning Caymanian. She got her degree, and so now we put her on a program for a year where she's going to work alongside the paramedics, and then she'll be a full paramedic on her own within a year. And so we've done that in we've recreated some of the positions to support and assist the primary role, but just so they can get the experience in order that they can feel comfortable, that we're comfortable with them handling our patients.
I love that. And that leads me to my next question. How does HSA help build a sustainable local healthcare workforce? Who wants to take that question?
I mean, HSA is committed to investing in training. I mean, we've put on a number of programs. We've seen the demand. We've seen the opportunities. Most recently, we've done some trainings in the area of EMS. We've had our own basic program. We're doing phlebotomists now because we've had to hire phlebotomists from overseas. We've done pharmacy technician. We've done the transition to practice with nursing. What are the other ones? We've done the operating room assistant, and most importantly, the healthcare aide. You have a lot of people that want to get into nursing in the medical field, and the healthcare aide is a kind of like a junior area for you to step, but you have to do the course on it.
Yeah.
And that has been a very popular one. We have about 60 healthcare aides within the HSA, and I want to be proud to say that all of them are Caymanian. So it's definitely a stepping stone to if you want to go in another area, whether it be the lab, whether it be nursing, or even medical doctors. You've got persons that have decided within that role that they want to be a doctor.
Yeah.
So so that's another area. And we also take clinical and medical internships for doctors as well. We get people from overseas, but we also have our local doctors come back and do their residency with us as well.
I love that. We talked a lot about nurses and the nursing program that you guys offer at HSA. But what I really do want to ask is the transition. Like, obviously, to get them into practice, right? How do you transition them from the program into practicing?
Okay, so let me clarify that during their training, they are with us.
Okay.
So from year 1 up to year 4 of their program, they're coming into the hospital or the clinics at various locations to ensure that what they learn in the classroom, the theoretical portion of their training, is also being exercised in the clinical as skills.
Yeah.
And so they do get that hands-on portion. So when they graduate at year 4, we now say, okay, you've graduated, you've gotten the theory, you have qualified in terms of the exam, but we still want to make sure that you fully grasp all the areas in order to manage on your own.
Yeah.
Because nursing is an independent practice. And so when they go through the Transition to Practice program, we now put them in different areas. They're also looking to see which area do I want to specialize in at that point as well. So we ensure that they have mentors who are senior, who are seasoned, experienced, to make sure that they can get the skill set from them and also help to manage their time as well as manage the patients at that point.
Do you guys watch, there's new shows out now, The Pit, Grey's Anatomy. There's so much of them out right now. You always like get these segment in the show where these nurses are shouted at for making mistakes or they're fired for not putting the right medication or something. Like it's so overwhelming. Give us a feel of the classroom. Is any of that going on?
Marsha can do that because Marsha was a former nurse.
Okay.
Midwife, yes.
You're allowed to talk about how intense it is because this is an important job. I don't want to go into a doctor.
Job.
Yeah.
Special people.
It's a very special job.
Well,
so.
the television tend to make you want to watch a show, and they're going to put some excitement. They're going to exaggerate. They're going to put some excitement there. But the basis of it is real in terms of you're going to have them they're nervous.
Yeah.
And so they're going to come and can I really touch? Do I hurt the person when I do that? So as mentors and seniors, we are there to ensure that they understand that you're not going to do anything wrong because we're here to support you, to make sure everything goes smoothly. So we're not like the television for sure. And we are always there to ensure that there's safety. That's the paramount to our patients.
Yeah.
Because we want to make sure that there's no mistakes. Yeah. And so that's why we're there. So if we're firm, it's firm to ensure that practice is safe for our patients because they're number one priority, even when we're trying to train our juniors as well.
It's so good that you said that. you want to make sure that they don't make any mistakes, because when you go into corporate fields, which I know Samantha Bennett has worked in numerous amount of corporate fields and high level jobs, some companies support mistakes. Like, we learn from it, we're going to grow, and it's okay. But I kind of feel like there's certain careers where it's like,
well, there's certain things you can't make a mistake, and there's consequences, right? But we have a just culture.
Okay.
And Marsha can talk a little bit about just culture, because we're not here to just blame and say, oh my gosh, and terminate you or fire you because you did this mistake.
Yeah.
We look at a number of things, and Marsha will, because she teaches this when you come on board, and it's a methodology that we've acquired across the board now through management.
Right.
Yeah.
So we look at it on a systemic level. We're looking to see were all the support needed available to the staff. We're also looking at being tired. Where our shifts are 12 hours. Is there enough persons on board? Which is why we ensure that we have adequate staffing at all times to prevent burnout of any particular individuals. We also look at what is the reason behind it. Is that you were unfamiliar? There goes, we need to ramp up training. So we're going to look at each point as to what possibly could have happened, and then we go from there. So it's not that there's no mistakes, because we're humans and we're going to err. However, we're going to use a system to assess what happened and how we can rectify, instead of using the system to blame and shame and fire persons.
Yeah. In a nutshell, you guys train your team well.
But on the other hand, healthcare is not the field where you encourage mistakes.
Yeah.
Because a mistake in healthcare can be what we call a sentinel event, which means people can die. And so we always want to minimize as much as possible any possibility of mistakes. But if it does happen, then just culture is what we use to correct and move forward with trying to prevent it from happening in the future.
Yeah, I mean, a lot of the staff members I've interviewed from different departments, and they talk about just how passionate they are about just reviewing things over and over and over, just to make sure that they were right. And this goes all the way to even the individuals that are responsible for driving the ambulance that we see daily, right? They're very, very particular on how they approach a scene, on patients that they're dealing with, what type of calls they're called out to. And then that resonated on the radio when they were talking about it. So they're extremely detailed. I remember, I completely forgot his name, but I think he's deputy chief, or whatever his title is. Yes. He spoke about just how encouraged he was when he traveled overseas for a training program, and he saw just how much they knew compared to the rest of the different areas in the United States, that we were more advanced. And that made me felt really good to know that. So it was a good thing. You guys train your staff well.
And that passion stems right down to HR when we look for the right people, and we don't fill positions just to put bodies in them. We got to make sure that we're getting the right person that's going to do the knowledgeable experience, is going to gel with the team, is going to be responsive to the patient. And so we take that very serious as well. And as much as, it's hard sometimes to find those specialized areas, the clinical, hard to recruit posts are very difficult at times, especially when there's a shortage around the world, in the region and all of that. But again, we're very passionate within HR to make sure that we match up those people in the right jobs, in the right area for the HSA, and to be part of that.
Is that hard, Samantha? Do you like?
Absolutely.
Yeah, because I'm saying you meet somebody in an interview and you're like, I really like them, but they're just not fit for this job. Yeah.
Right.
Does that become difficult?
And then you have people that you don't necessarily apply, and you approach them, and potentially, that is something they'd be interested in. And I do that all the time. I see people all the time.
Yeah.
And I feel like there's potential in that individual, and I'll give them my card.
Yeah.
And you know me, I'm going to do it. If I see somebody that has, really good customer service skills, and just basically very articulate and understanding, and, helps me really well, I'm going to see the opportunity for them. But when it comes to specialized and clinical areas, which is so hard to recruit, Andrea, the recruiting manager right now, she will tell you how difficult it is and how long it can take to fill a post, especially for your single incumbent posts, for like posts that are only held by one individual, like our pulmonologist. We looked for a pulmonologist for, I want to say 7 or 8 years before we actually had one.
Yeah.
And we finally got one, and he's doing a phenomenal job. He's booked up pretty much. We look like we're going to need another one, but at the same time, that didn't happen in a day. Yeah. I was speaking to this the speaker once that was in an event doing a TED Talk,
and he was talking about there was two fields that he knows for a fact that the individuals that get into these fields are really good at picking up on when people are manipulating them. All right, they're really good on your personalities and anybody that works in HR. Do you guys feel like that statement was real?
Yeah.
Like, as my aunt has worked in HR for such a long time, and I remember when I would run a fast one by her, she would say I paved that road. That road was already built by me, so you can try again.
There are things, there's intuitive initiative, and there's just things that you know within HR. These ladies will tell you some of the things about me that, they're shaking their head and laugh. They're like, oh my gosh, Miss Sam, they just, I don't know.
Are you really sick? All right.
Yes.
We're going to take a quick commercial break, and when we do come back, we have so much more questions to ask. We're so happy.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
Your Cayman Islands Health Services Authority has been the national healthcare provider of the Cayman Islands for many generations. We have elevated our level of care to ensure you, our patients, have the best possible experience. We offer better access to care close to home with the most locations on all 3 islands, delivering a full range of primary, secondary, tertiary, and emergency care. HSA is a JCI accredited organization, and we are committed to caring for you.
All right, welcome back to the show. Dane hanging out with you on Bobo 103.1 FM. All things HSA, this is what we're doing for the next hour. If you have any questions, please go ahead and send it through on the Instagram at 103.1 FM. Today, our topic is quite simple. HSA is talking about their training opportunities and careers. And if you have any questions, this may be your opportunity to say, hey, look, I want to get into the field of medicine. What are some of the jobs that are being offered? What would it look like if I was to become an employee one day? Or maybe I have filed an application before, and maybe this is a great way for you to figure out what your update looks like, because it is a field that is ever growing, but it's also a very intriguing field, and people are always applying every day. One of the questions I want to talk about, I want to touch on, is I want to talk about, and I want to see if somebody can elaborate more on this, but training for operating room assistants. That is one of those fields that a lot of people see that's very fancy on TV, and maybe they're saying to themselves, this is an area that I don't want to be a doctor, don't want to be a nurse, but this seems like it's more in my alley. Can we talk about, of course, the operating room assistants?
Yes, definitely. So we do offer the operating room assistance program, and this is one of our entry-level program as well. And these individuals basically learn how to prepare the OR prior to surgery, as well as break down the OR post-surgery. So they're integral to the process, and they work alongside our clinical professionals who actually complete the surgical procedures. And they learn different areas of the process in terms of equipment handling, patient preparation, sterile techniques, and how to generally support the team to complete the surgical procedures.
I love that. Love it. I didn't even know you guys offered that program. I had no
Yeah,
idea.
we a couple of years ago, we developed the program because we saw the need for additional persons. And we had quite a number of people within the housekeeping department that actually transitioned into that particular area. We've also done a healthcare aid program, which is a lot of our housekeepers and our porters moved up from that. So we do the program internally. Anybody wants to move internally, and then we do it externally as well. We have 260 individual posts within the HSA. So at any given time, that's the titles that we hold. And some of those, we have in the area of nursing, for instance, we have almost, I said earlier that we had about 274 nurses.
Yeah.
And that's various nurses. So you got your registered nurses, you got your midwives, you've got your critical care, you have your peds nurses, pediatrician nurses, you have dialysis, you have your
mental health,
medical, you have the surgical. Mental health is a big one that we've developed, and we've done a program now where mental health workers, that they're a little bit a step above the healthcare aides. So we're doing some training with that. Some of our workers did that one. I believe we have 2 or 3 that are assisting with Poinciana and stuff like that. But that's an area that's growing quite rapidly as well.
It's an important area too. It's such a big topic these days.
Yeah, mental health.
Yeah.
Yeah.
So I'm
and
glad
then we
that
have
you guys are doing
Alex's
that.
place as well. So
Yeah.
that's developed a lot. So I say that to say, I wanted to also say that, you know, when we talk about the numbers of HSA, there's 800 plus clinical staff, and then you have another 100 plus that are clinical support, and that would be your operating room assistants and stuff like that. And then you have 300 plus, almost 350 of non-clinical. And that can be in the area of IT, that can be in the area of marketing, that can be in the area of materials management, HR, registration. That's a big area where we have a lot of staff where, you know, in all these locations and being open 365 days of the year and every day in every location, you've got to have a person to register you when you come to see the doctor or you come to get a service. So our registration and payment processes, we have 40 plus of those. And then we've got a number of health environmental service workers. They're more like the clinical cleaners of the areas, whether top to bottom, they keep our hospital beautifully clean and safe, our hospital rooms. So that's another area that we have as well, along with the porters, which is another entry level. So yeah, we have various areas that people can step into, start to grow and move up the ranks to various higher posts.
Yeah.
And that's not just in the clinical, but also within the support areas as well. Yeah.
That's great. It's really amazing. One of the topics that I'm very passionate about is obviously mental health, but also mental health not only for what you guys do you offer as a career opportunity, but mental health within the organization. And this is going to lead me to my next question, because what personal qualities do you look for in someone that you're trying to hire in healthcare? And the reason I ask this question is because without saying too much, because of policy and just respecting the privacy of the hospital, I do have a family member that does work at the hospital and very, very passionate about the healthcare. This is a field that she wants to explore more and she wants to get into on a doctor's level. But then I remember, how excited she was to come home and talk about certain things that, happened in the workplace. And then I noticed that there were times that it felt like she needed a break or something was happening. This is always an exciting person when you're around her, right? Just very enthusiastic. And I kind of realized that sometimes what you witness on the job can take a toll, and you don't know when it's happening, right? And I've spoken to a lot of the HSA staff members about this. What's your safe space? But also, what does your qualities look like? Who are you as an individual? And all of them, every single one of them, without ever hearing the interviews or being a part of the interviews that I've had and asking the question, it always comes back to one thing. The one thing that they know that they needed to have was a special care for people. They all said the same thing. You need to care for people. Mm-hmm. This is not a career for you if you don't like
That's
people.
right.
if you don't have
right.
patience or you don't care for people. The two qualities you need to have. So I want to ask you, the guys that are in charge of hiring at the end of the day, a very difficult job. What are you looking for when you interview someone, like above all?
Okay. Well, Dane, if you look at our branding, HSA, Caring People Quality Service, so that's where we begin. You have to look for people who are compassionate, people who are professional in the line of work, especially, across the board, not just clinical, but non-clinical as well. People who are willing to work together as a team. Teamwork is fundamental, and they're able to adapt to various changing circumstances, because things can go sour very quickly. Yeah. And that person must be able to be flexible and adaptable. We're also looking for people who are committed to patient-centered care. And these are very essential qualities. Strong communication skills is a must, both verbally and written, and also the willingness for them to learn and to become successful.
And empathy.
Yeah.
It's a big one. Compassion is definitely another one. Understanding, patience. Mm-hmm. Patience for patients.
Mm-hmm. Yeah. So true. Story behind that, a testimony behind that was, there was something that happened to a family member where there was a major concern with the heart of a baby. and I just remember there was all these decision making things that needed to be done at the time. I just remember the doctors pretty much, they came in and they were pretty much just calm, settled, and they were asking questions, but it looked like they did not care. That's the one thing I got out of it. They did not care, right? I just felt like at the time, if I can say it in layman terms, you didn't have a heart. They didn't feel like there was any empathy there, right? I will never forget what I asked the doctor. I said, how could you not, you see everybody in the room is crying. You see that we are obviously, we're out of it right now and we're feeling like this is the end of the world for us, right? And you're not in our atmosphere right now. You're not crying, you're not letting yourself go. And I didn't know what I was saying at the time, but I always remember what the doctor said. He calmly, because this is empathy, he calmly sat me down and he said, do you want me to project your feelings right now? Do you want me to cry or do you want me to do my job? Because that's what I have to do.
Yeah, professional.
Yes, I have to keep my focus.
Because we are very cognizant of what you're going through.
Yeah.
But in doing so, we also need to be supportive of you. So if I start crying with you, that's not me empathizing and be able to look around the room to see and observe what's going on, because then my emotions become part of the process. So I'm no longer able to actively support you as I should, because then I need someone to help me as well.
Yeah.
Right.
But I love what he said too at the end of everything when it was all done. You know, he still managed to find me and he said, you know, Mr. Ramoon, I don't want you to think I don't have any feelings, because when I take off this jacket and I go home in my room, I'm thinking about what took place here today, but I can't do it.
And so, and I wanted to bring up the fact that, you know, the psychological safety for our employees as well, and when they go through traumatic experiences, because it's not all good when you come to the hospital, obviously. You know, the situations of debriefs that happen. You have EMS that get on the scene of a terrible automobile accident and see people dying, or, you know, situations, or persons or EMS have picked up patients and then they've died on the way, or, you know, passed away and stuff like that. So there's debriefings, there's immediate debriefings, and we also have a on-staff counselor that staff can, you know, have contact with and sit with and talk about them going through that situation or something that's affected them. I've had a situation where a nurse had been tending to a patient for a long time on the ward, and then within a few days of the person passed away for unrelated illness, and they had got attached to that individual, and it was like losing a family member. So we have that, and we also have our EAP that we also refer staff to when they, you know, when they're overwhelmed and they need to have some discussion. And then we have, you know, peer conversations with our managers and our colleagues and stuff like that. So we do care about those that are possibly taking things on a toll or taking things very emotional or burnt out, and it's overwhelming their personal situation. So we do care a lot about the wellness. And with that said, there's a particular role within the HSA that we call the Wellness Rewards and Recognition Coordinator. And we've hired somebody specifically to deal with wellness for our staff. And that she organizes wellness events for our staff. There's programs that we facilitate through that section, or basically just dedicating to the wellness and the you know, their how they're feeling, and whatever we can do to make them feel better, whether it's fitness, whether it is understanding how to handle on the work stress or how to manage your time. We have a number of events that we deal with wellness in that area, and that falls under HR as well.
No, personified health presently what we use. Employees can also do the activities on that app to earn an extra day off. And so that could be your wellness day. And we offer that. You can get that every quarter, so you can have up to 4 for the year. And as Ms. Sam mentioned, debriefing, like for specific instances, like you have CPR was unsuccessful, staff need help with that. And of course the EAP. And we do introduce these at orientation. So once the employee comes in, we inform them of all of these benefits that they could access, as well as our long-standing employees are aware of that as well.
Absolutely. I love that. How about vacation for your staff members?
Yeah,
like
that.
Yeah. Doctors take time off too. Nurses, everyone.
Everybody gets vacation, and we sometimes we have to force people to go.
Yeah. And that was my line of questioning. Like, how does that work? Do you have to step in and make it mandatory that they take the vacation for certain periods?
We have allocated vacation times, and it's scheduled throughout the year. And of course, with our doctors in particular, we have to bring persons in to replace them for short periods. We call them locums. Okay. So we actually fly in specialists to fill them in. We don't just say shut down the clinic for that 3 weeks. No, we bring in individuals in ENT, for instance, or pulmonology, or because there's ongoing clinics happening there. So we'll do that. We have people that have to fill in for people in Faith Hospital in the BRAC. Okay. So we'll send some people over to there from here, or we'll bring them in from overseas as well. And then we also have visiting specialists as well that fill in and fill some of the gaps as well, like Dr. Claire. She's been there for many years. She's one of our dermatologists that she's on our staff, but she comes in twice a month. So we have a lot of, coming and going to fill in those spaces. But sometimes we have to say, listen, you need to go on vacation. Yeah. You need to take a break and get some respite and really take the time and rest.
Yeah, yeah, it's important, very important. Talking about rest right now, we are going to take a very short commercial break. When we come back, we'll wrap things up here with this very important topic, courtesy of HSA. Keep it locked.
It's one of the best moments of your life when you welcome your baby into the world. The HSA's experienced women's health and maternity team provides the highest quality of care throughout your pregnancy and delivery. As a JCI accredited hospital, we are the leader in maternal care, safely delivering over 700 babies annually. Visit hsa.ky for more information. At HSA, we are committed to caring for you.
Welcome back to the show. We are Bobo 103.1 FM. I am your host, Dane. Welcome. Don't forget, if you have any questions for any of the staff members here that we are currently interviewing, you can go ahead and send us your questions through to our Instagram or Facebook at Bobo 103.1 FM. Okay, we're going to have the individuals in the studio just because this is pretty much our last segment. And we're going to have them reintroduce themselves just really quick to our new listening audience. Ladies, anyone that wants to start, you can give your job, your name, of course, and your title.
Hello, I'm Marsha Eleweanya, and I'm the Training and Development Manager with the HR department.
Hi, I'm Andrea Brown, and I'm the Acting Recruitment Manager.
Hi, I'm Samantha Bennett, and I'm the Chief Human Resources Officer at the HSA.
Welcome again, ladies. Thank you so much for taking the time to answer some of these really important questions in regards to your department and just how you can best give as much educational responses to our listening public. Does HSA, this is a really good one, does HSA collaborate with any educational institution here locally? Because we know they're pretty much growing here on the island.
We absolutely do. We partner with international educational institutions as well as local institutions. So we have a formal memorandum of understanding with the University College, Cayman Islands, to foster growth for our young persons as well as those who want to transition into other career fields as well. We do have partnerships internationally with institutions like Baptist Health to ensure that we have international standards. So if, for example, in our radiology department, we would have a radiology nurse going over and observing Baptist Health Hospital and what they do, so we can bring back ideas from those institutions. We also partner in Jamaica with the Ministry of Health and the University of the West Indies for a scrub technician program. And we do have an employee who completed that program and is back full-fledged in the operating theater, assisting in surgery. So we're excited about things like that. And we do have 2 nurses who are currently completing their critical care nursing program with the University of Technology.
Education is a must at HSA. I love it. This is a very easy one because I know how you guys do this already, but for the listening public, how does working at HSA contribute to the wider Cayman community? Anyone wants to touch on that one?
A career at HSA is more than a job. It's an opportunity to serve and grow and make a lasting difference in the community, serving the people. It's very rewarding. Whether you're a nurse on the front line or a doctor, or whether you're in registration or you're in HR and you're part of the admin team. We do think that, there's opportunities for persons to grow within that in our organization. There are many pathways available to fulfilling a career within healthcare. And we encourage people to go online and go onto social media and the website and to follow us. We place all of our vacancies on there where we basically update that on a weekly basis. Follow our social media as well. And we also put in on those platforms some of the training and development that we're doing, like the phlebotomist course that we're just in the middle of doing, and any other training that's coming up that can basically get your foot in the door of starting a career within the clinical and medical field.
Love that. Thank you so much for that. Ladies, we're going to be honest here with this one. When I was growing up as a child here in Cayman, there was only really one hospital that you can go to, and that was HSA. Now it feels that you can throw a rock and you can find a medical center, right? So this is a really important one to ask, because you guys are very competitive, right? Mm-hmm. How competitive is the application process for HSA and just the various programs that you have, compared to any other medical centers here?
I'm not sure what it is compared to the other opportunities. I just know for some of the entry-level posts and the mid-level posts, it can be very competitive, and it is a process that we get overwhelmed with applications. But, as much as we can hire Caymanians in these particular fields, we will, if we see a particular need and we need to do some training and development, like we do believe that we have a couple of healthcare aid vacancies available, and we need to do a course and we need to get some more people trained up, then we're going to do it.
Yeah.
But it is a competitive world to some extent for some of the posts. But everybody goes through a process of applying, meeting the criteria, being tested, being interviewed, and then sometimes you just have a lot of good applicants for one post.
Yeah.
But that doesn't mean if you don't get this post now that you're not going to be considered for something else down the line. We've done that. We've been impressed by many panels for one particular job, and then we've drawn on them and said, boy, they would really be good in patient experience. They've got a real good personality. They're very outspoken. They want to help. So maybe they should be considered for this role, and we'll call them up and ask them, do you want to be considered? And we've had wins in that situation, and persons move over. So, I say that to say, don't be discouraged, because it can be a competitive process, but, you may not get the job this time, but you may get one down the road, or you may be considered for an alternative. And, sometimes those individuals don't work out, and then you're the reserve.
Yeah.
That's the alternative as well. We've seen very many successes. And I want to say this also, which is very important and close to my heart, is we believe in second chances as well. So we have had people have had situations and convictions and stuff like that. So don't not apply because you've had a conviction, because we asked that question.
Yeah.
Just be honest and tell us exactly, yes, I have, but I still want an opportunity, because depending on how you meet the criteria, you get interviewed. We don't discriminate. We don't say no. If you meet the criteria, you get tested and you're successful, we'll interview you. And if you did well, we'll probably give you that opportunity. I'm not promising everybody gets that opportunity, but I'm saying we have people within our organization that have had second chances, and we don't hold that against anybody. So we're happy to do that as well. So everybody just needs to apply.
Any success stories in that area?
Oh, I have many.
Yeah.
I mean, I've had a gentleman that, came to us, and he did very well in the interview, and the HR officers told me about him, and they said, maybe you should have a conversation. I had a conversation with him, and we had a very open, and he was very humble, and he said, I did what I did, but I need to provide for my family, and I just need an opportunity. And that individual, he'd served some time. We started him out at a porter. He moved up to healthcare aid, and he moved up to bigger posts since then. I've had another one who came in as well, and he had a bit of a history, and he needed to provide for his daughter who was away in college overseas.
Yeah.
And, I have a very candid, open conversation with them to understand exactly what happened in their past, what did they learn from it, and all of that. This individual ends up becoming Employee of the Month 6 months later. So those are the success stories, and we do. And I just wanted to say that, we do believe in that. So again, people just need to apply, need to be open, honest, and forthcoming, and you may get that opportunity as well.
Yeah, I think the honesty is so important because
it is.
Yeah. You know who you're working with right off the bat when somebody's honest and they can tell you, I've done this, but I'm looking ahead now.
Yeah.
And I want to do this. So it's good that you guys are doing that. There's not a lot of corporate companies or companies, period, that are giving those second chances.
Yeah.
So really do appreciate HSA for doing that. Which leads me to my next question. What advice would you give to someone that's considering a career in healthcare? I think this is an all-around question for all of you.
We don't only employ persons who have degrees. So we start persons out at entry level knowing that you have the potential. So don't feel like, okay, I can't go to the hospital because I'm not a nurse, I'm not a doctor, I'm not a phlebotomist. You can start out with us, even in our housekeeping department, any entry-level position for that matter, and move on up. The other thing that I want to say is that we are training champions at HSA for 2025 with 2 entries and 2 awards for the Chamber of Commerce for our training programs.
Yeah.
And so we do have a high standard at HSA.
Those. We're very proud of
and
those
so,
awards.
and
Marsha is
so
very-
HSA do work alongside its employees. And so the sky's the limit when you come to the HSA as to where you want to be. And I'm a prime example of that as well, because I started out as a registered nurse and midwife in the emergency department, and I've gotten the opportunity to move into 2 positions.
Yeah.
Now I'm in HR as a training and development manager. So you don't have to enter the organization where you want to be, but you can move around until you get to where you want.
But you got to be prepared to start at the bottom.
Yeah.
And you know, we've got to put that into our youth at these days, because many people just want to come in at the top of the midway. You know that, right?
Yeah.
But you know, and even like temporary situations, I've said to people, if you can come and work for us on a temp, you get your foot in the door, we can experience you, you can experience us to see if this is what you want to do. You know, so sometimes we do have opportunities for temp positions, but at the same time, you know, it's you have to be willing to start at the bottom, and once you can, you're good with that, and you can make your way up, and you can put in the work. There's opportunities, great opportunities for you.
I love that. Anything you want to touch on?
Volunteers as well.
Yes.
We have persons who come and start as volunteer and say, I'm not sure what I want to do.
Yeah.
So let me volunteer. And then they realize, I actually love this. Let me go and do a certificate.
I just want to say that I've been with the organization 29 years now, and I did start from the bottom as a clerical officer. So, you know, my final note to our listeners is that if they're considering a career, HSA is the place. It's more than just a job. It's an opportunity to serve the people of the Cayman Islands. So we encourage anyone interested in healthcare to explore the different pathways that we offer. And it's available. We post our jobs online, as Ms. Samantha says, on a weekly basis. We also advertise in various mediums, social media, Compass, etc. So if anyone is interested, they need to put that application forward to start that journey with us.
And we attend all the career fairs, by the way. We attend all of them. We're in career fair mode right now.
Yeah.
Last week, you know, we do the primary schools, we do the high schools, we do even the government orchestrated job fairs. You know, wherever we're asked, we're willing to be there and showcase what's on offer at the HSA.
Yeah. But can I also say, guys, beyond nurses and doctors, you guys offer so many different opportunities in so many different fields. One of my favorite that you guys have now implemented at HSA is the experience team.
Patient experience.
Yeah, patient experience. Yeah. We had an opportunity to interview them, and I didn't understand at first. If you're looking from the bird eye view, you didn't understand why that was so necessary.
Absolutely.
And you forget about our seniors that come to the hospital often, not just for them, but they have so much questions. Like my mother-in-law is one of those individuals that if she's going to a hospital, she's so scared to ask a question, right? Because she feels that she's interrupting the duties of the doctor or the nurse, because she can tell that they're extremely busy. But because you guys implemented that department, now these people are so caring. They will sit down with these older folks. I've witnessed it myself, and help them with their applications, help them with their questions, and not feel like they have to be rushed. And that feels good. If you have any questions, because the hospital is so big now, if you have any questions, you can sit there and just ask those questions. So
And
props to that.
She reminded me that we do the patient transportation as well.
Oh wow. Okay.
We
Oh,
do
wow.
like we have a lot of people that we have to transport for dialysis, for instance, for medical appointments, and take them back.
So you pick them up from their homes? Oh wow.
We do home visits too. That's growing
I
up.
was told that from
Yeah.
we had an interview around that. I just didn't know you guys actually pick up patients.
Yeah, we do.
Okay.
We have a whole transport crew. We introduced them probably about 3 or 4 years ago, and there's a crew of about 6 drivers. EMS used to pick them up, and that used to take them away from their job, and there used to be competition on time in the vehicle. So now we designated a unit that specifically focuses on those appointments, picking people up, transport that's needed, and taking them back home, especially those that are immobile that can't really move, and they're in their chairs and stuff like that. So we always provide that team as well.
That is so good. Guys, any last minute message that you would like to give to our listening audience?
HSA is absolutely the best place to be. And so if you're thinking about healthcare, HSA should be your number one choice. We do offer a wide variety of training programs, and you can tell I'm passionate about training. And so you definitely, for our trainings, they're advertised on our website, but you can also reach out to us at HSA as well to get additional information on any of our programs that we offer. And they're offered throughout the year for persons in the hospital as well as the general public.
Perfect. Thank you.
And working with the HSA, you're not just working with a local hospital. We do have that market edge because we are accredited hospital with the Joint Commission International. And so we pride ourselves in that. So anyone interested in applying, they will be working for an international-based standard accredited hospital.
So good.
So needless to say, I want to say that HSA has come a long way over the years. But with that, we've had to acquire the appropriate persons, the knowledge, the safety, the accreditation along that, and that has raised our standard as well. The population of Cayman has grown, and we have to serve everyone. We don't have the choice to turn away anybody. That is not an alternative. So we need to have the right people. We need to find the specialized individuals, and we want people to explore opportunities within the HSA. So we're saying, if you're interested, come, go online, follow us on social media, and see what opportunities are available there, and let's take it from there. Have a conversation.
Absolutely love it. Ladies, thank you so much for your time and knowledge, and we really appreciate it, and hope to see you guys again.
Yeah.
Thank you.
Thank you.